Hello YouTubers, it is 7/13/2014. Well, I'm starting to have people telling me about symptoms and all this sort of thing. So I thought it was imperative to once again put up everything about radioactivity, radiation, what can be done about it. This is Weeping Willow 2. And I've gone through all of my videos and gathered the information to put it all in one spot. And I got some info off the web. I got, anyway, this report here is from the Mayo Clinic, as you can see. Okay, so let's get on with it. This is radiation sickness. Radiation sickness. And this is the symptoms. Okay, symptoms of radiation sickness. Alright, I'm going to set the camera down and go through this. Alright, the severity of signs and symptoms of radiation sickness depends on how much radiation you've absorbed. How much you absorb depends on the strength of the radiated energy and the distance between you and the source of radiation. Signs and symptoms also are affected by the type of exposure, such as total or partial body, and whether contamination is internal or external, and how sensitive to radiation the affected tissue is. For instance, the gastrointestinal system and bone marrow are highly sensitive to radiation. Okay, now, y'all, I want to tell you something. If there's ever a nuclear bomb set off, and you happen to see a flash through your windows, whatever, do not, I caution you, I warn you, do not run to the window if you see this flash. You hit the deck. That means lay down on the floor, get behind a couch, get behind something solid, and you stay down, because within a few seconds it's going to be blowing. The impact of the blast from this nuclear bomb is going to hit your house. And you don't want to be standing up when that happens. You duck behind something sturdy and lay down, wait for impact. You teach this, please, to your children and your family and your friends and anybody you can speak to. If they see a flash, you better hit the deck and hit it pretty daggone quick. Okay, let's get on with the report. Absorbed dose and duration of exposure. The absorbed dose of radiation is measured in a unit called a Gray GY. Diagnostic tests that use radiation, such as an X-ray, result in a small dose of radiation, typically well below 0.1 GY, focused on a few organs or small amount of tissue. Signs and symptoms of radiation sickness usually appear when the entire body receives an absorbed dose of at least 1 GY. Doses greater than 6 GY to the whole body are generally not treatable and usually lead to death within 2 days to 2 weeks, depending on the dose and duration of the exposure. At that point, they'll just make you comfortable, if you're even around anybody that's going to be able to provide that care, and give you painkillers and stuff like that. Okay, initial symptoms or signs and symptoms. The initial signs and symptoms of treatable radiation sickness are usually nausea and vomiting. The amount of time between exposure and when these symptoms develop is an indicator of how much radiation a person has absorbed. After the first round of signs and symptoms, a person with radiation sickness may have a brief period with no apparent illness, followed by the onset of new, more serious symptoms. In general, the greater your radiation exposure, the more rapid and more severe your symptoms will be. Early symptoms of radiation sickness: mild exposure is 1 to 2 GY, moderate exposure is 2 to 6 GY, and severe exposure is 6 to 8 GY, and very severe exposure is 8 to 10 GY or higher. Okay, then you have nausea and vomiting within 6 hours. Within 2 hours on the moderate, 1 hour within severe, and within 10 minutes on the most severe exposure. Diarrhea is a symptom that does not occur until you have been hit with 2 to 6 GY, and that happens within 8 hours. The 6 to 8 GY is 3 hours, and the severe exposure is 1 hour. Headaches do not occur until normally 2 to 6 GY, and that's within 24 hours. The severe exposure is within 4 hours, and the very severe exposure is within 2 hours. All right, fever, none from 1 to 2 GY, 2 to 6 within 3 hours. 6 to 8 is within 1 hour, and the very severe exposure is within 1 hour. Later symptoms of radiation sickness: dizziness and disorientation. Nothing on the 1 to 2 and 2 to 6 GYs, and then 6 to 8 you have within 1 week. And the very severe is immediately. Okay, weakness and fatigue within 4 weeks on the 1 to 2, within 1 to 4 weeks on the moderate from 2 to 6 GY. Then within 1 week on the severe exposure, 6 to 8, and then immediate on the very severe exposure, 8 to 10 GY. Then as far as hair loss, bloody vomit and stools, infections, poor wound healing, low blood pressure, all right, that does not occur within the mild exposure of 1 to 2 GY, and the 2 to 6 GY, that will happen within 1 to 4 weeks. Severe exposure 6 to 8 GY is within 1 week, and the very severe exposure 8 to 10 GY or higher is immediate. Okay, adapted from radiation exposure and contamination. The Merck manuals, the Merck manual for healthcare professionals. When to see a doctor. An accident or attack that causes radiation sickness would no doubt cause a lot of attention and public concern. If such an event occurs, monitor radio, television, and online reports to learn about emergency instructions for your area. If you know you've been exposed to radiation, seek emergency medical care. Okie dokie. Let's see what this other... Okay. Causes. Radiation is the energy released from atoms as either a wave or a tiny particle of matter. Radiation sickness is caused by exposure to high dose of radiation, such as high dose of radiation received during an industrial accident. Common exposures to low dose radiation, such as X-ray examination, don't cause radiation sickness. Oh, excuse me. And, of course, it doesn't say it here, but nuclear weapons, okay. Source of high-dose radiation. Possible sources of high-dose radiation include the following: an accident at a nuclear industrial facility, an attack on a nuclear industrial facility, detonation of a small radioactive device, detonation of a conventional explosive device that disperses radioactive material, a dirty bomb, detonation of a standard nuclear weapon. Radiation sickness occurs when high energy radiation damages or destroys certain cells in your body. Regions of the body most vulnerable to high energy radiation are cells in the lining of your intestinal tract, including your stomach and the blood cell producing cells of bone marrow. Well, I don't produce bone marrow anymore, so I guess I'm fucked. Okay, let's see, tests and diagnosis. When a person has experienced known or probable exposure to a high dose of radiation from an accident or attack, medical personnel take a number of steps to determine the absorbed radiation dose. This information is essential for determining how severe the illness is likely to be, which treatments to use, and whether a person is likely to survive. Information important for determining an absorbed dose include known exposure. Details about distance from the source of radiation and duration of exposure can help provide a rough estimate of the severity of radiation sickness. Vomiting and other symptoms. The time between radiation exposure and the onset of vomiting is a fairly accurate screening tool to estimate absorbed radiation dose. The shorter the time before the onset of this sign, the higher the dose. The severity and timing of other signs and symptoms may also help medical personnel determine the absorbed dose. Blood tests. Frequent blood tests over several days enable medical personnel to look for drops in disease-fighting white blood cells and abnormal changes in the DNA of blood cells. These factors indicate the degree of bone marrow damage and is determined by the level of an absorbed dose. Dosimeter. A device called a dosimeter can measure the absorbed dose of radiation, but only if it was exposed to the same radiation event as the affected person. Survey meter. A device such as a Geiger counter can be used to survey people to determine the body location of radioactive materials. Type of radiation. A part of the larger emergency response to a radioactive accident or attack would include identifying the type of radiation exposure. This information would guide some decisions for treating people with radiation sickness. Okay, complications. Radiation exposure that causes immediate radiation sickness significantly increases a person's risk of developing leukemia or cancer later in life. Having radiation sickness could also contribute to both short-term and long-term mental health problems, such as grief, fear, and anxiety about experiencing a radioactive accident or attack, mourning friends or family who haven't survived, dealing with the uncertainty of a mysterious and potentially fatal illness, worrying about the eventual risk of cancer due to radiation exposure. Treatments and drugs. Okay, treatments and drugs. The treatment goals for radiation sickness are to prevent further radioactive contamination, treat life-threatening injuries such as from burns and trauma, reduce symptoms, and manage pain. Decontamination. Decontamination is the removal of as much external radioactive materials as possible. Removing clothing and shoes eliminates about 90%. Did you hear that, folks? Removing clothing and shoes eliminates about 90% of external contamination. Gently wash with water and soap removes additional radiation particles from the skin. Decontamination prevents further distribution of radioactive materials and lowers the risk of internal contamination from inhalation, ingestion, and open wounds. Open wounds. Okay, treatment for damaged bone marrow. A protein called granulocyte colony stimulating factor, which promotes the growth of white blood cells, may counter the effect of radiation sickness on bone marrow. Treatment with this protein-based medication, which includes filgrastim, nepogen, and pegfilgrastim Neulastix, may increase white blood cell production and help prevent subsequent infections. If you have severe damage to bone marrow, you may also receive transfusions of red blood cells or blood platelets. Treatment for internal contamination. Some treatments may reduce damage to internal organs caused by radioactive particles. Medical personnel would use these treatments only if you've been exposed to a specific type of radiation. These treatments include the following: potassium iodide. This is a non-radioactive form of iodine because iodine is essential for proper thyroid function. The thyroid becomes a destination for iodine in the body. If you have internal contamination with radioactive iodine, your thyroid will absorb radioiodine just as it would other forms of iodine. Treatment with potassium iodide may fill vacancies in the thyroid and prevent absorption of radioiodine. The radioiodine is eventually cleared from the body in urine. Potassium iodide isn't a cure-all and is most effective if taken within a day of exposure. Prussian blue. This type of dye binds to particles of radioactive elements known as cesium and thallium. The radioactive particles are then excreted in feces. This treatment speeds up the elimination of the radioactive particles and reduces the amount of radiation cells may absorb. Those that don't know what feces is, you can look it up, but it's your bowel movement. Diethylenotriamine, pentaacetic acid, DTPA. This substance binds to metals. DTPA binds to particles of the radioactive elements plutonium, americium, and cerium. The radioactive particles pass out of the body in urine, thereby reducing the amount of radiation absorbed. Supportive treatment. If you have radiation sickness, you may receive additional medications or intervention to treat bacterial infections, headache, fever, diarrhea, nausea and vomiting, dehydration, and burns. End-of-life care. A person who has absorbed large doses of radiation, 6 GY or greater, has little chance of recovering. Depending on the severity of illness, death can occur within 2 days or 2 weeks. People with a lethal radiation dose will receive medications to control pain, nausea, vomiting, and diarrhea. They may also benefit from psychological or pastoral care. Okay, prevention. In the event of a radiation emergency, there are precautions you can take. In the event of a radiation emergency, stay tuned to your radio or television to hear what protective actions local, state, and federal authorities recommend. Yeah, right. Okay, recommended actions will depend on the situation, but you will be told either to stay in place or evacuate your area. Shelter in place. If you're advised to stay where you are, whether you're at home or work or elsewhere, do the following. Close and lock all doors and windows. Turn off fans, air conditioners, and heating units that bring air in from outside. Now, I question that because I was told that it doesn't bring air in from outside on the air conditioner. So, I mean, shit, you're going to have a bunch of people suffocating in their damn house because they can't breathe. Turn off fans. I mean, come on. But anyway, do what you want, y'all. Close fireplace dampers. Yeah, I can see doing that. Bring pets indoors. Yeah, I can see about doing that. Move to an inner room or basement. I don't have a basement, but y'all, if you do, I guess I'd go there. Okay, stay tuned to your emergency response network or local news. Evacuate. If you're advised to evacuate, follow the instructions provided by your local authorities. Try to stay calm and move quickly and in an orderly fashion or manner. In addition, travel lightly, but take supplies, including flashlight, portable radio, batteries, first aid kit, necessary medicines, sealed food such as canned and bottled water, manual can opener, cash and credit cards, extra clothes. Okay. Be aware that most emergency vehicles and shelters won't accept pets. Take them only if you're driving your own vehicle and going someplace other than a shelter. Okay, that's the end of it, folks. Okay, well, have a good one. God bless, take care. Carol Roberts. Hello, YouTubers. It is 7/13/2014. Well, I'm starting to have people telling me about symptoms and all this sort of thing. So I thought it was imperative to once again put up everything about radioactivity, radiation, what can be done about it. This is Weeping Willow 2. And I've gone through all of my videos and gathered the information to put it all in one spot. And I got some info off the web. I got, you know, anyway, this here, this report here is from the Mayo Clinic, as you can see. Okay, so let's get on with it. This is radiation sickness. Radiation sickness. Symptoms also are affected by the type of exposure, such as total or partial body, and whether contamination is internal or external, and how sensitive to radiation the affected tissue is. For instance, the gastrointestinal system and bone marrow are highly sensitive to radiation. Okay, now, y'all, I want to tell you something. If there's ever a nuclear bomb set off, and you happen to see a flash through your windows, whatever, do not, I caution you, I warn you, do not run to the window if you see this flash. You hit the deck. That means lay down on the floor, get behind the couch, get behind something solid, and you stay down, because within a few... And this is the symptoms. Okay, symptoms of radiation sickness. Alright, I'm going to set the camera down and go through this. Alright, the severity of signs and symptoms of radiation sickness depends on how much radiation you've absorbed. How much you absorb depends on the strength of the radiated energy and the distance between you and the source of radiation. Signs and symptoms